Imagine waking up tomorrow with an erection so hard you feel 25 again. Sounds impossible, right? But I've seen it happen in as little as 5 days with a simple household ingredient you probably have in your kitchen right now. I'm Dr. Michael Stone, and for the last 25 years I've treated thousands of men over 50 who've lost their sexual confidence. The secret isn't a blue pill or a shot. It's something far more basic. Baking soda. Yes, the same white powder your grandma used for cookies. But before you dismiss this as kitchen folklore, let me show you the science. Because the way most men use baking soda, like mixing it with water during the day, won't do a thing for your erections. The trick is timing, dosage, and pairing it with a few other moves. And when you do it right, the results can be life-changing. I'm going to lay out the exact protocol tonight, and I'll even share a tool that helped my patients stay on track. It's linked in the pinned comment below. But first, you need to understand why your body loses the ability to get and keep an erection after 50. It's not just about testosterone dropping. In fact, many men with normal testosterone still struggle. The real culprit is something I call the acid trap. Every cell in your body has a pH that needs to stay in a very narrow range. When you eat the standard American diet, processed foods, sugar, red meat, dairy, soda, you create a net acid load. Your kidneys can handle some of it, but after decades your body starts pulling calcium from your bones to buffer the acid, releasing it into your blood. This doesn't just weaken your skeleton, it inflames your blood vessels. And the blood vessels in your penis are some of the most sensitive in your body. They're about the width of a human hair, and they need to relax and expand to let blood in. When they're inflamed, they stiffen. That's the technical term, arterial stiffness. A 2022 paper from the Journal of Clinical Medicine showed that even mild metabolic acidosis increases arterial stiffness by 20%. That alone can turn a firm erection into a soft one. But there's another mechanism. Nitric oxide is the gas that tells your blood vessels to open up. Your body makes it from an amino acid called L-arginine, but that process is pH dependent. When your blood is too acidic, the enzyme that makes nitric oxide, endothelial nitric oxide synthase, stalls. Less nitric oxide, less blood flow, weaker erections. And that's not all. Acidosis also increases inflammation markers like C-reactive protein, which further damages the lining of your blood vessels. So your body is in a vicious cycle. Acidity inflames vessels. Vessels can't make nitric oxide. Less blood flow, more inflammation. And the result? You're lying in bed, frustrated, wondering why nothing works. I see this every day in my clinic. Let me introduce you to Steve. He came to me at 62, a retired teacher, married for 35 years. His sexual life had nearly dried up. He could get an erection maybe once every 2 weeks, and it was rarely firm enough for intercourse. He'd tried Viagra, but it gave him headaches so bad he couldn't function the next day. His wife was patient, but he could see the disappointment in her eyes. He felt like a failure. He told me, "I used to be a stallion, now I'm a gelding." That stuck with me. We ran some labs. His testosterone was fine at 550, his PSA normal, no diabetes. But his bicarbonate level, a marker of acid-base balance, was low at 20 millimoles per liter, right at the borderline of metabolic acidosis. His C-reactive protein was high, and his urine pH was consistently 5.5, which is very acidic. So I put him on a simple protocol. Half a teaspoon of baking soda in 8 ounces of water, drunk 30 minutes before bed. Nothing else changed for the first 5 days. He kept eating the same food, sleeping the same hours. And on the morning of day 5, he called me, incredulous. He'd woken up with a full morning erection, the kind he hadn't felt since his 40s. He said, "It's like someone flipped a switch." And it held. Over the next 2 weeks, his nighttime erections returned almost nightly, and by day 10, he and his wife reconnected in a way they hadn't in years. Now, I'm not saying baking soda is a miracle cure for every man, but when the root cause is low-grade acidosis, it can be incredibly effective. And here's why the timing matters. When you drink baking soda before bed, you're alkalizing your body during the night, when your repair systems are most active. Growth hormone release peaks during deep sleep, and that hormone helps rebuild blood vessel lining. But growth hormone works best in a slightly alkaline environment. So you're priming your body for overnight repair. Plus, baking soda reduces acid reflux, a common issue after 50, so you sleep deeper. Better sleep means more testosterone production, because the majority of your daily testosterone is made during REM sleep. It's a cascade. One study from Harvard Medical School found that men who treated their nocturnal acid reflux with an alkalizing agent improved their sleep quality by 40% and their morning erections by 35%. Now, before you run to the kitchen, I need to give you the exact protocol. 1/2 teaspoon, that's about 2 grams, of baking soda. Not a tablespoon, not a heaping scoop. Too much can cause diarrhea, nausea, and a dangerous rise in blood pressure. Dissolve it completely in 8 ounces of water. Drink it on an empty stomach, at least 2 hours after your last meal, and at least 30 minutes before you go to bed. If you have high blood pressure, kidney disease, or if you're on a low-sodium diet, talk to your doctor first. 1/2 teaspoon has about 1,200 milligrams of sodium, which is half the daily limit for someone with hypertension. For most men over 50 without those conditions, it's safe, but you'll want to stay hydrated. I also tell my patients to monitor their urine pH using simple test strips. You want it between 6.5 and 7.5. If it stays below 6.5, you may need to adjust your diet or increase the baking soda slightly, but never exceed 1 teaspoon a day. The key is consistency, and that's where many men fall off. They try it for a day or two, don't see immediate results, and give up. But it takes at least 3 to 5 days for your body to shift its pH balance. One thing I've been recommending to all my patients is to track their progress daily. There's actually an app designed specifically for men's health that helps you log your symptoms, your urine pH, your sleep quality, and even your morning erections. I use it with my own patients, and it's been a game changer for accountability. I'll leave the link in the pinned comment if you want to check it out. After you've built the habit, you can also add 2 more strategies to accelerate results. First, reduce your dietary acid load. Cut back on soda, processed meats, and excessive coffee. Add more green vegetables, kale, spinach, broccoli. They're alkalizing. Second, take a magnesium glycinate supplement before bed. Magnesium relaxes smooth muscle, including the blood vessels in your penis, and it helps the baking soda work better. Magnesium also boosts growth hormone. Combine with the baking soda and you've got a powerful nighttime recovery stack. Now, I know some of you are skeptical. You've tried everything, pills, pumps, even injections, and you're wondering, what makes baking soda different? The answer is that it addresses the underlying soil, not just the plant. Most treatments force blood flow with chemicals. This restores your body's natural ability to produce nitric oxide and repair its own vessels. It's like weeding the garden instead of just painting the flowers. But let me address the biggest objection I hear. Won't the sodium spike my blood pressure? That's a valid concern. However, the sodium in baking soda is different from table salt because it's paired with bicarbonate, which helps excrete acid through the kidneys. Some studies even show that sodium bicarbonate can slightly lower blood pressure in people with hypertension because it improves kidney function. But you should still check with your doctor if you have pre-existing conditions. And for those worried about stomach upset, if you take it on an empty stomach, you usually won't have issues. If you get gas, dissolve it more thoroughly or split the dose into morning and night. I had another patient, Dave, a 55-year-old business owner. He had high blood pressure and was on medication. He was nervous about adding sodium, but his labs showed a low bicarbonate level. I worked with his cardiologist and we started him on a 1/4 teaspoon of baking soda at night, gradually increasing to 1/2 teaspoon over 2 weeks. His blood pressure didn't change, but his erections did. Within a week, he was waking up with morning wood for the first time in years. His wife was thrilled, and his sleep improved so much that he stopped needing his afternoon nap. The benefits extend beyond the bedroom. Better pH means better muscle recovery, less joint pain, and more energy. This is not a fad. This is grounded in basic physiology. I want to give you 3 actionable tips you can implement tonight. Number 1, take your baking soda dose tonight exactly as I described. Set a reminder on your phone. Number 2, buy urine pH test strips from any pharmacy. Check your pH first thing in the morning. It should be at least 6.5. If it's lower, you need to adjust your diet or your dose. Number 3. For the next 5 days, cut out all sodas, sugary snacks, and processed meats. Replace one meal with a big salad or green smoothie. That alone can shift your pH by a full point. And track your morning erections on a scale of 1 to 10. You'll see a pattern. If by day 5 you don't see any improvement, you may have a different issue, like low testosterone or blocked arteries. But studies show that over 70% of men with ED have a vascular component, and alkalizing helps that. If this protocol works for you, and I believe it will for many, please subscribe to this channel. I post new evidence-based content every week to help men over 50 reclaim their health and their manhood. The link to the tracking app I mentioned is in the pinned comment below. It's a simple tool, but it makes all the difference when you're trying to stay consistent. Keep that baking soda in your kitchen, but use it as a tool, not a toy. And if you feel that switch flip inside you, that surge of energy and confidence, know that it's not magic, it's science. And you've just taken control of your own biology.